All right. So today we're supposed to be talking about kind of discussing the return to play following a positive COVID diagnosis. So I sent out kind of the most popular thing going around is the British Journal of Sports Medicine, their guidelines that were released for return to play. And then I believe, let me see if it's in here. I believe the NFHS and American Medical Society also created a little return to play as well, guidelines wise. So kind of just started off with if anybody has any questions to kind of start it or anything they're considering. Has anybody kind of developed one or had to use one yet? So we haven't had any positive students yet to our knowledge.
Well, Sarah, if what would the situation be? I know there's challenges with students going to different primary care physicians, pediatricians, and they may not all follow what's going on to any extent. Is there something that you're doing as a school where you're going to funnel them through your team physician or cardiologist specifically?
So we are lucky enough to have a parent who's a cardiologist that we could use along that route, and I'll share my screen real quick. So this is what I've put together for our students. So if we have someone who is diagnosed as positive, this is kind of what we'll be sending with them to go to their healthcare providers. So at the bottom here, it provides kind of where this information is coming from for the doctor so that they can see, you know, this isn't just something we came up with on our own that we want our kids to go through, that we're pulling from these, the American Medical Society and the National Federation for High Schools to kind of back what we're asking them to do. I know one of the biggest topics is, you know, do we require cardio evaluation no matter what, or is there certain criteria? So what I had found that some other high schools who are in season and playing in different states are using is this quick cardiac screening for the doctor to review. So it's chest pain, tightness with exercise, unexplained syncope or near syncope, unexplained excessive dyspnea fatigue with exertion, new palpitations, or heart murmur on exam. So what we've asked is that if they're answering yes to any of those questions on a cardiac screen, that they do further follow-up work with a cardiologist. So since we pull our students from so many different counties and spread out, I don't plan on having them go through one physician, but rather using this form and communicating with those offices about kind of this protocol that we'd be going through.
Can you scroll down to that second page?
Yeah, to the return to play, or just down to the...
Oh, I'm sorry, the third.
Yeah, this
Is
nice
this
little
something
guy.
you'd be willing to share?
Yeah, I can absolutely share this. I have it in a Google Doc, so I can share it so you guys can pull the diagram out. I think part of this will be just the relationship you have with local doctors that kids go to see. I think right now I'm lucky to have been with this school long enough that I know most of the doctors by name and I've talked to a lot of them individually, so they're familiar with paperwork and things that we send. So I don't anticipate a lot of issues. I think the biggest wrench might be Kaiser, just because Kaiser's Kaiser. That would probably be what I'd be worried about the most. So. And then I think also the other part too is just educating the parents on why it's important as well. So I think a lot of our parents, when you throw in the worry about the cardio conditions after their kid's already gone through this, they'll take that a lot more seriously than a lot of the other typical injury things that we deal with and on those types of things.
Is there a time frame that you're looking at for doing this?
So the time frame we would follow is 10 days since the onset of symptoms has passed. So your typical COVID timeline, as far as before we even consider starting a return to play process, is, that the requirements to even come back to school, which is 10 days after the diagnosis or start of symptoms improving and no fever. So, and then what we are requiring for our faculty and staff and our students is, in addition to just that knowledge, is them bring us a doctor's note stating that they can return to campus, that they've reached the point where they can. So it's all documented. And then once they reach that, then we get into the return to play, which is what I have found through the British Journal of Sports Medicine was essentially a 5-day step. And it seems really similar to almost a concussion protocol, return to play. So starting them off with that light exercise, gradually increasing, watching and making sure that they're able to handle it, breathing wise, cardiovascularly, that they're not having issues. I know with we've had a staff member who was diagnosed on campus, and he pushed it a little too soon to come back. As far as, he met his 10 days, but then when he started to do activity on campus and helping with things, he actually had a setback and had some symptoms re-pop up just because he pushed too far. Just like with any typical illness, when you push your immune system a little too much, the shortness of breath came back, the cough came back, and he had to kind of take another week or so off before he really pushed any kind of physical activity. So I think that's what we would look for as we're progressing them through this activity. So, and let me screen share that page. So this is how it kind of lays it out. So it has 5 stages, and it's a total of 6 days, with day 7 being that return to full activity. So it's a minimum of 7 days, but it might take longer for them to meet each of these goals. So I know in one of the things in talking with my football coach already about this, about, what the timeline would look like if we had somebody diagnosed, that, you're really, if they're symptomatic, you're looking at a minimum of 17 days. And then if they're asymptomatic, what they ask is that they wait the full 14 days of the timeline, and then another 7 days. So then you're looking at 21 days total. So it is, I told him, and he was like, well, that's almost a whole season. I said, well, it's really more similar to, it's a concussion. It's very similar to a concussion where, if you have that really mild symptomatic concussion and they're back in 10 to 14 days, or you have the kid who has symptoms for 2 weeks, and now that timeline's even longer. So, because I think beyond doctors and parents, the next battle will be coaches and their understanding of the timeline and how long this will take.
You had any pushback from faculty, staff, coaches, administration?
No, administration has really been on board. We had 4 cases on campus in August among staff. And that was kind of our first being thrown into the deep end of how long are they out? What do we require of them to come back? But all were on board. The only issue we ran into, which will probably be seen a little bit in athletics, is one of our staff members didn't have a primary care physician. So we were requesting a doctor's clearance to return to work. And at the time they had an appointment set up a month later they had gotten a new doctor. And so when they called me about that, I said, well, just call the person, call the doctor. More than likely, as soon as you tell them you're a COVID positive person and what your timeline is, they'll schedule a virtual appointment with you and get that taken care of. So I think on the athletic side of things, I know I do have a general care physician I can use in the event of an athlete who doesn't have a primary care or doesn't have insurance, that we can at least get them in and evaluated on. And then we also have clinical lay here in town that some of our kids go to. So.
Would you have, say you have a staff member like a maintenance worker or something like that, where they have a physical job? Would you have them go through that? More for athletics.
I think right now, just athletics. I think we kind of had that happen. The person who was positive wasn't a maintenance worker, but takes on some duties just to help on campus with that type of thing. So I think we would leave that decision kind of to their primary care when knowing what their job duties were when they could come back. So we have a pretty small maintenance staff. So it's not a huge concern, but it would definitely be something worth considering just from a liability standpoint of them getting hurt on the job because they couldn't fulfill duties. So, something for the bigger ups to consider sometimes. But I mean, so far with we haven't run into it yet with athletics, but through the school, when we had our positive cases, we didn't have any pushback, and we've had one person exposed, and they were understanding in that even though during the time period after they were exposed, they had 3 negative tests, that they still had to fulfill that full 14 days of quarantine. And then we've had a couple staff members who have just gotten a general cold and had symptoms and then tested negative. So everybody's been on board about staying home, getting us the documentation from their negative test and release back to work so far. And then we're utilizing sportswear for everybody this year on campus. So I've been able to keep those documents safely and recorded. So on that aspect of things.
How many kids do you have on? Go ahead.
No, go ahead.
I was just going to ask, how many kids do you have on campus right now?
So we range, I think on our red days, we have around 270, and on blue days around 250.
Okay.
So, and the biggest, they're actually pretty darn good about wearing their mask at school. That actually hasn't been an issue at all. Social distancing though, they are not good at. So lots of constant reminders on that. I had one set of girls who were sharing a lunch one day, and we had to go over why that wasn't okay right now to be sharing a bag of chips.
Yeah.
So, and it's just things they don't think about. It's not at the forefront of their minds as high schoolers. But otherwise things have gone well. It's going to be interesting when the weather turns cold and it starts to rain, because right now we're not letting them inside for lunch. They have to be outdoors, and we have plans to use our gyms and our dining hall, but it will make it a little bit more interesting. But I think on that end of things, the fact that they've been so good about wearing masks, as long as even when they're out finished eating lunch, they're good about putting the mask back on when they're done eating and not stretching that out. So I think as long as that continues, taking them indoors, it's a risk of going back to school and part of it. I mean, schools in the Midwest and South, they don't have open campuses like we do, and they're all doing it right now, all indoors all day. So, but we did install air conditioning and filters in all of our classrooms. So it's only our gyms that don't have anything.
In your return, like if somebody shows symptoms or they test positive, do you have like they have to have like 2 negative tests 48 hours apart? Do you like anything like that, or you just do it based on days and like symptoms and all that?
Yeah. So if they're symptomatic, and then what we've asked with physicians and students as well, who have emailed in and said that they're keeping their kid home because they're sick, we're requiring our school-based policy is 24-hour symptom-free before returning to campus. And then what we're asking of students and staff is that they contact their primary care physician for a consultation to decide if their doctor thinks they need a COVID test. Because since we're not footing the bill, we can't really force them to get a COVID test. And I'm sure if you guys are like us, you have parents who are on both ends of the spectrum, some who are scared to death and others who think COVID isn't real. So landing on that middle ground, that's what we've been asking. Most of our parents almost all have been fantastic about either keeping the student home until the illness is totally passed, and then most are talking to their doctors and getting COVID tests. So if they have symptoms and have a negative COVID test, we just ask they give us that documentation and then wait until symptoms have resolved for 24 hours to return. If it's positive, if they've had a direct contact exposure to a positive person, we're asking them to stay home for 14 days. So we've had 2 close calls. We had a student who was in contact with a positive person, but it was 4 days before they started showing symptoms. So they fell out of that direct contact category. And then they also ended up getting tested as precaution, were negative. And then we had another student who was exposed to someone who got sick and would have been a direct contact, but that person tested negative to COVID. So we're dodging bullets. It's like a game of whack-a-mole, trying with everything that pops up in the different situations. One of my biggest concerns lately on our campus is the arrival of international students. So we have a boarding residence connected to our school. The students in that residence currently have been here since before this all started. So I think we only have 6. They never went home back to their countries. They've all stayed in the residence the entire time. But the plan is for new international students to arrive in January. Most of them staying in the residence who are doing a 14-day quarantine with them. So they'll be confined to their rooms, their own bathroom. But we do have homestays as well coming on campus. So a struggle has been getting administration to understand that even though a student coming from Germany who has 25 rapid COVID tests in her hand from her mom, who's a doctor in Germany, even though that test is negative every day, she still should not come to our campus for 14 days. So that's been a struggle on that end.
Is your school doing testing?
We tested all of our faculty and staff before we came back. We coordinated through our local hospital. We were able to bill insurance for all but the Kaiser patients. The plan was to pay out of pocket for everyone else, but I believe they maybe found a donor who was going to cover that cost for us. And then our public health officer has recommended testing 100% of the staff every 2 months. So that's the plan going forward. So in November, we'll retest everybody again. So, and we're exploring avenues. Our athletic director is exploring avenues for more testing and more rapid testing to hopefully add that in with athletics, especially is looking ahead into playing sports. But so far we're a small fish in a big pond, and anybody we've reached out to hasn't gotten back to us. So I know, I think Jesuit, I'm not sure where, our AD was talking to their AD recently, and they have an avenue for possible testing with a company that's looking to gather research and want to add more schools. So
they are doing antigen testing.
Yeah, they're doing the antigen testing.
Speak on that.
Go for it.
Oh.
So yeah, I'm at Jesuit right now. We are going to be doing rapid antigen testing for all students and staff once a week. So we have our students split up into 2 groups. The red group is coming to campus Monday and Tuesday. And so they'll test Monday morning. Everyone with a negative test is allowed on campus. If you have a positive test, you have to go home. Then you're referred to, we have 2 physicians that are working with us on this, and they'll kind of manage all of the care after that. So they'll test Monday, be on campus Monday, Tuesday. Wednesday is like a collaboration day for us. So just all online stuff, nobody's on campus. And then Thursday, the second group comes on campus. So we test all of them Thursday morning, they're here Thursday, Friday, and then repeat the next week. So realistically, everybody's getting tested the day they're on campus, and then they're only on campus 1 more day before their next testing. So we're supposed to be rolling it out next week is when we're gonna start like the first round of tests and see how it all goes. I think we're still working with athletics to figure that out, because right now we have different athletic pods that are not lined up with the same, kids that are going to be on campus for what days and all of that. I think that's going to have to change. And looking at maybe trying to get our athletic students to be tested twice a week instead. So they would test Monday and Thursday instead of just one day a week, or going to game day testing like Sarah was talking about, see if we could get testing for that so that we can have them tested beforehand. But we're working with Immunify. So it's one of their parents was a doctor and then another doctor that he works with, and they are trying to get out more testing basically. And so we're using an app through them to track everybody, student and staff test results. And then we're going to use an app to check in when people come on campus. So green is negative test results. They've done a symptom check that was all negative. Negative test result, but they have symptoms. And then the people that are in the yellow are going to be seen. We have an on-campus medical professional that was hired just to handle COVID. So she'll be managing those students and trying to decide if they need to, quarantine for the 14 days because they're symptomatic, but they had the negative test, or if more steps need to be taken. So I'm not sure that part of the plan yet, but testing is starting next week. I know that.
Jamie, what is the cost to the individual or cost to the school, if any?
So Immunify is covering all of the costs for us. They have some grants that they're working with. I don't know, I have not been in those meetings, but I know it's free to the school and free to all students. And any additional testing needed is also free. So the doctors, one of them has a clinic that's like a mile away from the school. And if a student either misses his on-campus test, so he's not available Monday morning, and that was when he was supposed to test, he can go in the clinic and get tested for free. Or if there's somebody that had that yellow status, so they had a negative test, but they're symptomatic, they can go in daily and get rapid tests for free from them as well. Same thing with staff members. If they're symptomatic or miss a test for some reason, they just have to go down and get that test. So I'm not sure exactly. I think it's the CARES Act grant that they're working under. Like I said, I haven't been part of those meetings, but I know that it's no cost to the school.
Yeah, I think it was the CARES Act is what my AD said, that it was covered due to CARES Act.
So we're doing PCR testing on campus, not the antigen, and it is covered under the CARES for Kaiser and for private. So they have to just bring in a copy of their insurance card. If they don't have insurance, it's covered. So it's covered for that. I just didn't know if it was different for antigen, and what is the possibility of, say, testing your athletes every time before a competition, before going, and then obviously having your competitor do the same thing, so that when you're going out there, everybody's safe. So everybody's going to be traveling with you to play every competition or every level.
Yeah, I know that was my athletic director's goal with hopefully adding this type of testing in.
And that's something.
If CIF fell apart,
Yeah.
We could at least go play other Catholic schools or other schools that are testing. So.
Yeah, and that's something with Immunify too. They have basically told us if we just give them a schedule of events that we need testing for, they can schedule it. So if we say, these are the athletic events we need to test for, so far they've been on board with that, but I know they have a art walk thing, their fundraiser they're doing at school with some parents, and they've agreed to come do testing and screenings before that as well. So trying to get them on campus as much as possible, I think, for us.
It's a whole new world. So any other comments, questions, concerns? Could be return to play related or anything COVID related.
Of the schools that are here, just a show of hands, who has athletes back on campus or co-curriculars back on campus? Okay, we do too. What schools are is anybody in a hybrid situation other than Justin-Siena, where they have students coming back for school? Does anybody, Trina, you do?
Yeah, today's our first day, actually. So we sent a notice out and allowed the families to choose who wants to continue virtual learning and who doesn't. And it's a little less than 50% chose to come onto campus. Now, we lost quite a few numbers this year because COVID, private school, a lot of people went to public. So we have about 300 students. So essentially today on campus, we have a little less than 150 students on campus. So I had to do dual teaching today. I had to teach on Zoom and in class at the same time. It was interesting. But today was day one.
I had to substitute a hybrid taught class. So luckily the teacher, she was evacuated, so she was able to still teach from home, but I had to set her up in the classroom so the students in the classroom could see her. So she was teaching from home, students learning from home, and then students in the classroom. So that's been an interesting, with substitutes, they either are basically just moderators there to like help, or in some instances, like you're actually running the class as a substitute.
So I came in a little late to the meeting. I apologize. I'm doing the contact tracing for our campus, and there was a couple cases. So I was stuck in a meeting and I missed the beginning. You were talking about testing and screening the athletes prior to events. Is that something, or what was the topic?
The topic we started off with was return to play after positive COVID test. So that was kind of where we started with and ran through that. I shared a document that I put together for Justin that I'll get emailed out to everybody that you guys can pull from and use. And then we kind of went sideways into being back hybrid and testing for faculty and staff and students for school, and then segued that into testing for athletics.
Now for us, if someone, since I'm dealing with all this right now, I had to quarantine a number of people, including our cafeteria workers. So we had no cafeteria now at school's first day of starting for a good 2 weeks. But under my understanding of, even if you get tested and it comes back negative, you still need to be quarantined. Is that also what you guys are following with athletics?
Yes.
Okay.
Yeah. So we discussed that. What we're doing is if you've been exposed to a positive case, so you're a direct contact, that even if you have a negative test, you still have to fulfill the entire 14-day quarantine, since it has a 14-day incubation period. So you could test negative, and then on day 14, you could test positive.
Right.
So that's what we're following with direct contacts. If we have someone who just has gotten sick, symptoms came out of nowhere, they had no known direct contact with anybody who was positive, then we're accepting a negative test and 24 hours symptom free before they return to campus.
So you are making them test 24 hours or prior to return, or?
So we're asking that they consult their primary care physician. So, and so leaving that decision ultimately up to the family and their doctor on the student side of things. On the staff side, the 2 instances we had when they contacted their physicians, both recommended that they be tested. I feel like our faculty and staff are a little more cautious about getting COVID. There's a little, they're adults, so they worry maybe a little bit more than the students do. Whereas with some of our families, we have some families who are extremely cautious and go get that test, whereas others just say it's a cold and they're going to wait it out. That's where we are. And in our first week, I had 2 faculty members get tested and 2 students potentially exposed. So all occurred outside of campus.
I had a case where they decided to do a sleepover and a birthday party, and it really ballooned and flooded my phone calls. It's been really hard to manage. And then on top of that, the cafeteria workers who was getting ready for the first day of school had a case of a direct contact. So it's literally the past 3 days have been crazy.
Yeah, it's when it comes up, it's crazy, and then it all figures itself out so far for us. My message has been to faculty and staff members who, for the instance of one of our cases that was potentially an exposure, I got the comment of, oh, well, I know she's with this student all the time and they ride in the same car. And kind of the message we've given is look, we can't control what they do outside of the school. If it becomes a positive case, absolutely, we're going to trace that and do the best that we can to get those direct contacts under control. But we can't limit what they're doing outside of the school. That's their parent decision on how to parent them and what they're doing with the restrictions. But I can't, until I know it's a direct contact, I'm not going to tell that student they can't come on campus when it's not occurring on our campus.
So if it's a second remove, so say
That's
that
secondary contact.
do you, according to Johns Hopkins, I'm trying to follow with the training based on that. And if they had potential contact with someone who's been in direct contact, they're quarantined.
Yeah, so if in both of the cases that we had, we did not know if they were direct contacts yet or not. So we were still waiting to find out if this first student was even a direct contact. In the case of a student being a direct contact, then yes, we would contact who might be their direct contacts before we find out if they're positive and make them aware. So we have a letter template ready to go saying, you're potentially a direct contact. Here are the steps you should take. Quarantine for 14 days until we find out the information. We haven't run into that yet with students. We did with our staff members. We had just one person, because the staff it occurred in was on a separate part of our campus, and they're really only with each other, all the people who got it. There was one other person on campus who would have been a potential secondary contact. So he went ahead, stayed home from campus, quarantined until he found out the results of the person he had been in contact with. So we've done it and that's the only time we've had the instance where we've had to do it. And it was a really small, tight situation, and we were able to figure that out. But yeah, it will be interesting when it comes to that, of how far we go. And that's where we've had teachers who ask, what would happen if this happens? How many will we shut down the school? Will we shut down classrooms? And my message to them has always been, we're not going to know that until we're in the situation. We know how many people might be direct contacts before we can make the decision to shut down a classroom, shut down a day, shut down the whole school. We're just not going to know until that situation presents itself, because it could be like what we've already experienced, and it's a small pod of only 6 people affected, or it could be, one whole cohort of 2 days that we have so many possible exposures that we just need to shut them down for 14 days before we return.
One last question. When you are doing your contact tracing and you're trying to find out if they had close contact, I don't know any other way of doing it but sharing the name. On the Johns Hopkins, it said that if it's not a HIPAA issue, because you have to find, it's a public health concern, you have to know if they had contact with that person. That's what all of you are following as well?
So what our public health in Napa County has advised us is to investigate the direct contacts with the positive case only. So asking them, questioning, they have the questions to go through, find out who their possible direct contacts are, and then gather those names, contact information, and sending that information to the public health department, and then they will do further contacting. So that's what they've asked as a school for our role to be. So their point of it is that we are expediting the timeline of finding out direct contacts than what would happen for them. Normally for them, it would be even longer before they were in contact with the patient, finding out the direct contacts and then contacting them. So we're getting them that direct contact list faster from the school. And they said we should only be concerned about their direct contacts at the school.
Okay, so the secondary contact is not a concern. We don't report that to the county health,
Correct.
but quarantine on your campus based on your campus's guidelines.
Yeah. And so what we would do is if we had a positive case, we would send out our notification email like we did with our staff members earlier this year, identifying, when the case started, where on campus they had been located. And then it would be, if it was a situation where we knew we had to shut down, we notify them of that. But then it also gives the persons who were on campus notice of, hey, we've had a positive case. You were maybe in the same classroom because they were in this classroom. If you wish to stay home and quarantine, you can, or go get tested. So it gives them enough information that they don't know who the person is, but they know whether or not it concerns their well-being and where they were on campus, if that makes sense.
Okay.
So we have less than a minute because I don't have a pro account on Zoom and we're going to be cut off. So I will get that email out to everybody with the document that we created for our return to play. And I guess see you guys all in a month. Good luck.
Thanks, Sarah, for doing this.
Absolutely.